Good evening and welcome, Newark residents. Thank you for joining our fourth meeting introducing the Office of Violence Prevention and Trauma Recovery. At this time, I would like to take the time to welcome our Central Councilwoman, Ms. LaMonica MacGyver, our Central Ward Aide to the Mayor, Alteric Anque, Captain Cesar Suarez, Ms. Kettles from the Shani Baraka Women's Resource Center, and Captain Brown from the Central Ward Precinct. Tonight's meeting is specifically for the Central Ward, but all are welcome to participate. During this meeting, you will learn about the office, what it does, how it operates, and much more. This meeting is interactive, and we ask that you share your questions via Facebook comments or our Zoom Q&A. My name is Jennifer Fana, and I am the Administrative Assistant to the Newark People's Assembly. The office serves many purposes within the city of Newark, and some entail coordinating community meetings to bridge the gap in communication. Please register to our database by emailing us directly at newarkpeoplesAssembly@ci.newark.nj.us. Myself, along with Miss Andrea Mason, will be your host, and we are ready to start. I would like to please welcome Miss Andrea Mason.
Good day, all. Good evening, actually. So I need not say anything more. Jennifer has handled it very well. Thank you, Jennifer, for that lovely introduction. I'd like to turn it over now to our Central Ward Councilwoman, LaMonica MacGyver.
Greetings, everyone. So it's a pleasure for me to be present tonight. We have been spending a lot of time talking about behind the scenes about the Office of Violence and Prevention, and I'm excited about tonight's community meeting to introduce the office, all of the amazing people who are working in the office underneath the direction of Keisha Yuri. I am excited about it. And so definitely for all of your questions, as Ms. Jennifer nicely and kindly put it, definitely drop all of your questions, any concerns in the chats, either on Facebook Live, all on Facebook Live, excuse me, so that we can address some of your concerns, some of your questions. This is your time, Central Ward and any ward that's participating in tonight's meeting, to get engaged, find out what's going on in your city, and find out more about the Office of Violence and Prevention and Trauma Recovery. So enjoy tonight's session, and I'm looking forward to participating in the presentation tonight. Thank you.
Can we just take a step back? I apologize. I noticed that there was a QR code on the screen and we didn't acknowledge it. So for those of you who may be listening in, you don't see it, but if you are watching or on the Zoom forum, you do have access to complete the ward survey. If you could use your smartphone, and you can actually use the camera option to click on the to scan the QR code. There is a survey for every single ward that we've done thus far. And at the very end of the series, we'll actually send a link. So if you weren't able to take the survey, you'll be able to answer it via the link that I send via email. So be sure to register, as Jennifer Fana mentioned, via email, or register with Newark People's Assembly, via email at newarkpeoplesAssembly@ci.newark.nj.us. And we will now hear from the Director of the Office of Violence Prevention and Trauma Recovery, Lakeisha Yuri.
Good evening, everyone. How are you? Thank you so much for having me tonight. I'm excited that we are back again discussing the Office of Violence Prevention and Trauma Recovery. I thank everyone for tuning in tonight. As we begin, we would like to just introduce that I've been working for the city of Newark for about the last 5 years, and I'm a licensed clinical social worker, and I have been working for many years to prevent and intervene in the cycle of violence, not just in the city of Newark, but helping with strategic strategies locally and nationally. Thank you for having me tonight.
Okay, so thank you. And I do also see that our Captain Cesar Suarez, the commanding officer of Newark Special Victims Unit, is on. We'd like to hear from you, Captain Suarez.
Hi, good evening, everyone. Again, I'm Captain Cesar Soares. I'm the commanding officer of the Special Victims Division of the Newark Police Division. Our squad handles all our domestic violence related cases, our sex assault crimes, missing persons, and that of the like. I'll be here and can answer any questions you may have regarding any of those areas in which we investigate. Thank you for having me.
And as our other special guests come on, we'll introduce them accordingly, but we're going to move directly into the meeting. So we're going to hear from Director Yuri about exactly how the Office of Violence Prevention and Trauma Recovery was formed. You're muted, Director Yuri.
So the Office of Violence Prevention and Trauma Recovery was formed back in June of 2020 in the wake of the George Floyd climate. Mayor Raj J. Baraka established the Office of Violence Prevention and Trauma Recovery. In a historic move, he allocated 5% of the public safety's budget for the office to support community-based violence intervention programs. The office will be located at the former First Precinct over on 17th Avenue. And this is also the site where the 1967 rebellion sparked out of. Mayor Baraka ultimately tapped me to begin to be able to bring domestic violence, sexual assault, and community violence under one umbrella. And as we begin to pull violence reduction initiatives into one place, we ultimately are working alongside law enforcement to have community-based public safety. We're bringing public safety and public health together to be able to combat the cycle of violence in the city of Newark.
So thank you, Director Yuri. Not to disrupt your flow, but I do see that Mayor Baraka has joined us, and I could not allow him to be on the line without acknowledging his presence. Thank you, Mayor, for joining. At this time, would you like to say anything, or you want Director Yuri to continue her program?
Oh, no, I mean, Director Yuri can continue. I just want to thank everybody that's on, that got on. I believe Councilwoman is on as well. This is incredibly important for us as we move public safety along. Some of the strategies that we want to use. Obviously, the police have been doing a decent job in the city, but they need to do better. Obviously, if we can get them to do better, the better for all of us in terms of crime reduction and their relationship with the community. But there's some things that we can prevent, that we need to get involved in before it turns into a crime, or prevent retaliation or help police reduce crime. Public safety is a community problem. It's just not a police problem. You know, we can't just throw our kids out in the street and things happen and then make everybody responsible for it. We all have to be involved in it. This is an opportunity for us to get community involved in policing and creating public safety in our own community alongside of the police department. So Keisha, I know she's doing a great job, so go forward. I'm sorry I'm late.
Thank you. Mm-hmm. So ultimately, this is going to be a collaborative conversation. And so I'll, make sure I get through the information quickly so we can have a conversation with the councilwoman and the mayor and public safety, so that we can get to the community's questions. So we're going to, move through it pretty quickly so that we can address the community. So the Office of Violence Prevention and Trauma Recovery, the scope of work. So we're developing a strategic plan to realize the mayor's aim to strengthen the collaboration and coordination between law enforcement and community-based public safety initiatives. We're going to use data and research to inform the work that we're doing so that the city can further invest in violence prevention programming. We're working with My Brother's Keeper and other agencies, Bloomberg Association, to be able to help us with the strategic planning for the Office of Violence Prevention. So we have, and one of the quotes that we have from the mayor, and we see it here, is that it will be a representation of the progress we have made as a peaceful community and the positive advances made by our police division to suppress crime by being engaged with the community, not alienating from it, which is ultimately what he said, that crime and violence is not a law enforcement problem, but it ultimately takes all of us to be able to come up with strategies together to be able to combat the violence in our communities. So we have an advisory group that's been working with us, that's helping us to give the recommendations and it's for the direction of the office. We've been working with Katine Sharir from My Brother's Keeper, Princess Fortin, she works for the New York City Department of Violence Prevention, Akila Sharils from the Newark Community Street Team, Will Simpson from Equal Justice USA, Dr. Juan Rios from Seton Hall University Social Work Program, Kalisha Wingfield Hill and Shoshana Page, the policy advisors to Mayor Baraka, have been ultimately helping to shape and build the Office of Violence Prevention and Trauma Recovery. So we have identified priorities. And the priorities that we're looking at in terms of the Office of Violence Prevention is supporting citizens to have an active role in creating public safety. Like the mayor said, public safety is not just up to law enforcement. We want to mobilize law enforcement and community to focus on the hotspots. We are mapping the hotspots in the city, and so we are mobilizing law enforcement and community to work together so that we can put resources into those communities. We want to shift the culture to think about trust, healing, and resilience. So ultimately, when things happen, the community is traumatized by it, but we want to build some trust with law enforcement. We want to heal the community, and we want the community to know that they have everything that they need to be able to be resilient and to rebuild the community. And we want to invest in the capacity of the Office of Violence Prevention and Trauma Recovery. We want to build some infrastructure and sustainability for this office. So as we give the citizens an active role in creating public safety, ultimately what we see here is that it's safety and well-being is at the center. And so as we look at creating the citizens' active role in public safety, we want them to know that this requires deep and authentic community ownership. The community has to have some ownership in the conversations and public safety. We want to focus, we want the focus of public health to be on health, safety, and the well-being of the entire population. We want to identify that the risks and proactive factors at the community level engage preventive strategies that are evidence-based and closely evaluated. We want to make sure that we understand what the risks and protective factors are in the community. And we want to begin by putting public safety and public health data into the community's hands, which empowers their decision-making and action. No longer do the community not have any of the data and that it's in a silo, what's owned by someone else. If we have the information and the data, the community should have access to it. We want to mobilize law enforcement and community to focus on the hotspots. And the way that we do that is through a collective impact approach, where we deploy violence prevention resources to the community. We want to make sure that the resources are trickling down to the people who need it the most. We want to bring together in a structured way. We want to bring people together in a structured way to achieve social change, starting with common agendas. It focuses on collective goals, strategic partnerships, and shared actions and accountability. And so that is major. The accountability piece is major, where we have people in the community providing services, but there's no accountability. So we want to start to make sure accountability happens. We want collective action to involve a community-driven solution to public safety by engaging a local leadership with the community members. We want to bring those things together so that it is a cycle where we are having impact collectively, that is shared responsibility, where we are mobilizing law enforcement and community together in the hotspots. So we want to shift the culture to think about trust, healing, and resilience, right? We want to utilize the social determinants of health framework to advance community healing and strength building. We want the social determinants of health, we want them to know that it's a whole community and a whole person, and we're not working with people in fragmented ways. We want to talk about the inequities in wealth, environmental conditions, access to services, quality housing. We know that quality housing can help drive these outcomes. So we want to help people to be able to work on their social issues, their health issues, and we know that these things ultimately helps people to become resilient in a community. We want to combat inequities caused by structural racism with strategies that acknowledge the harm caused by the decisions of the past. And we also want to counter them with community healing and strength building activities. So we have to acknowledge historical traumas, structural racism, to understand why we are in the system or the issue that we have today regarding public safety that is systemic. And lastly, we want to invest in the capacity of the Office of Violence Prevention. We want to develop strong organizational design. We want to recruit expertly qualified staff. We want to train and empower staff to collaborate and lead. We know that partnership and collaboration is the way that this has to work. We want to engage the rigorous evaluation and assessment of progress for the goals that we're trying to achieve. And that's the way that we want to ultimately work to invest in the capacity of the Office of Violence Prevention and Trauma Recovery. That trauma recovery aspect is a place that helps us to sustain, because we have to heal the community after things happen. But the organizational design is certainly important in this as we're building the office.
So Director Yuri, I know that you have several programs and divisions within the office. And I also see that there are a few of your team members on the line. If you want to introduce them and we just hear a little bit more about what they do after you tell us what the programs are, that would be appreciated.
Okay. So under the Office of Violence Prevention and Trauma Recovery, let's see who we have on. We have the Brick City Peace Collective. We have the Shani Baraka Center. We have the Anti-Racism and Hate Crimes Unit. We have a outreach team, therapeutic teams with clinical supervisors, clinical social workers, and therapists. And so as we look at the programs, we want to just be able to talk about what they do in their respective places and how they help public safety. So on the line, we have a representative from Shani Baraka Center, Ms. Janice Kettles. We had Dawn Haynes under the Brick City Peace Collective. I'm sure we have others on that represent the other programs. The Office of Violence Prevention, the VOCA team, Victims of Crime Act team, which works with domestic violence, sexual assault. So we have a gamut of the programs that are here on the line. So we have the Newark Community Street Team. They are a part of supporting the active role of creating public safety. So Newark Community Street Team is a program where they help with the interruption initiative, where we enlist former gang members or returning citizens back into the community to help us to be able to mediate and intervene in some of the issues that are happening. Newark Community Street Team is operating out of the South Ward and the West Ward. We have the hospital-based violence intervention program, where we have specially trained workers in the community who are based out of the hospital, who helps people who are injured from bedside until the time they are discharged. We have the Newark Anti-Violence Coalition, who are a group of collective activists who are working through social and political awareness to bring the public health aspect to the community, to let them know that violence is a public health issue and that we help support you long term. So as we talk about mobilizing law enforcement and community to help focus on the hotspots, we have the Brick City Peace Collective, which is a 16-member collaborative working at the community level to reduce violence and conflict. So the Brick City Peace Collective has the aspect where we're working in partnership with all the community-based organizations, and to ultimately be able to hold them accountable for the work that they're doing. We have the public safety roundtables that's happening every other Tuesday, and that is hosted by Newark Community Street Team and Equal Justice USA. The Shani Baraka Women's Resource Center, which is a multifaceted agency that works with women who are in crisis and helping them through their transitions. We also have the mental health co-response with the police, which is ultimately in development, but we call that the Office of Wellbeing, where we have social workers, case managers, and victim advocates who are going out instead of law enforcement and with law enforcement to help with some of our issues around homelessness, mental health, poverty, our quality of life kinds of issues. Anti-racism and hate crimes unit is in development, where people can come and have their issues heard around race and ethnicity discrimination. And harm reduction centers. We're in the process of creating those centers where people can get assistance with addressing their opioid addictions and other related issues related to justice involvement. The Office of Wellbeing, I just spoke about. Our Victims of Crime Act is where we have outreach workers and therapists who are at the community level. They are relatable and they look like people in the community, whereas people don't have access to mental health treatment. And because of our lack of trust with social services and systems, we ultimately created the VOCA team to be in the community to help people who have issues with emotions and mental health. Equal Justice USA has the Trauma to Trust training that brings community members and law enforcement together to foster empathy and mutual understanding of trauma through conversations about race, violence, and social and economic injustice. And so those are the programs that we have, but we have so many more that we didn't even mention. But ultimately, under the Office of Violence Prevention and Trauma Recovery, we ultimately are looking at the data to work through how we inform our work. So did we want to ultimately go through this piece, or did we want to talk a little bit differently about the programming?
So before we hear about the stats from
Right.
Tyus, can we hear from some of your program managers?
Absolutely. I believe Dawn is on the line. If she can just talk a bit about some of the work that the Brick City Peace Collective is doing and has done. And Miss Janice Kettles is also on, representing the Shani Baraka Center.
Yes, ma'am, I'm on. Peace and blessings, everyone. So the Brick City Peace Collective, as Director Yuri mentioned, we are a collaborative effort in the sense of we have several organizations on our team. We have the City of Newark Public Safety, which is our police department. The Newark Public Safety Collaborative, NPSC, they deal with our data. So they give us data in collaboration with the police department so that we're very accurate with the amount and the numbers and the statistics of what we're dealing with. The North Community Street Team, as our director mentioned, the wonderful things that they do in our city, the North Anti-Violence Coalition, the North Community Solutions, which deals with our court systems, and they help with our youth when they have youth court, and that is what their specialty is, and our station house adjustments. And those are our students or our juveniles who may have had interactions with the police department and need redirection. So they really have those supportive services there. We have the Newark Opportunity Youth Network, the Newark Street Academy. So when our students are out of Newark Public Schools and perhaps that didn't work out for them and they might have tried like Lead Charter School or one of our charter school networks and that didn't work out for them. And those are the ones that are often written off. Newark Street Academy not only give them a stipend, but they also teach them knowledge of self and they do a lot of life skills and personal development, which to me is phenomenal. And if we can get in North Public Schools and that in that capacity, the wonders we would make in our district. We also have the University Hospital, as well as My Brother's Keeper, My Sister's Keeper, the Westward Victims Outreach, Brick Education Network, Equal Justice USA, North Beth Israel Hospital, The Hub, the New Black Panther Party, and of course the North Board of Education. So together with all of our partners, we have partners that are geared towards the who is doing it, the crimes that are being committed, the what is being done, the where that is being done, and our job is to come up with how to fix it. So in some cases, we have referrals that come in from the police department, from our lovely councilwoman. She takes full advantage of the Brick City Peace Collective, and we pull up and we show out. We do listening campaigns, letting the community know, no, you're not by yourself. You know, you're not feeling these feelings of trauma, dealing with what's going on in our city by yourself. And we're here to assist in different capacities, whether it is we're doing prayer memorials, visuals, shutting down blocks on listening campaigns, mentoring services, and we do referral services. One of our biggest referral services providers is the Hub because they deal with the age demographic of what some of our perpetrators are right now, which is between the ages of 13 and 18. So, you know, we are working, rocking and rolling and finding out what the gaps is in their respective organizations. So if there's someone that needs assistance, like let's say, for example, someone has capacity building issues, there are people that are part of the collective that say, hey, well, let us help you build capacity in your organization. Let's figure out how to build what it is that you're missing. So when we deep diving into these conversations and the data and what it is that we're missing, we're able to plug in resources. And that to me is one of the key parts of the unified efforts in the Brick City Peace Collective. And that's what I do.
So
I hope I didn't miss anything.
Before we move to the next manager, Ms. Haynes, two quick things from you. So it sounds like you have a lot of partners. Is there a number on that? How many partners are within the Brick City Peace Collective? What makes up the collective? How many?
So not including the mayor's office, there's 16 other organizations associated with us.
Okay, 16. And if there are nonprofit organizations or people that want to get involved, is it an opportunity? Is it an open kind of forum for people to join? Is it, you know, what do you suggest people do if they are or have an organization that's willing to participate?
So we are definitely looking for partners, and the way that it works, right, is they reach out to me, brickcitypeacecollective@gmail.com or haynesd@ci.newark.nj.us. And I'm not afraid to give out cell phone number. It's 201-618-7907. And we offer during our Brick City Peace Collective meeting, maybe within our agenda first half, we allowed them to come do a presentation. So we've had presentations from Mentor Nork, who is a strong supporter, and I absolutely adore Mr. Thomas for his efforts. We've had one, I believe we have one coming up from the Covenant House, because we know that that's also a demographic of folks that need the supports and services. So we find ways of making sure that the information is very fluent. 11, I don't want to mess their name up, but we have a new rehab center inside of Newark that does detox, and they are part of, you know, this conversation as well. So not saying specifically a part of the 17 of the collective, but we do have supportive situations for them to be able to present and be used as resources and have direct contact for referrals. And that's the importance of that unification.
Perfect. I do appreciate it. Thank you.
You're welcome.
Ms. Kettles?
Greetings, everyone. Glad to be invited to this outstanding forum here. Um, Let me try to get this camera going here. Okay, there I am. Moving around. Okay, my name is Miss Kettles. I'm the manager / grief specialist at the Shani Baraka Women's Resource Center, located at 300 Clinton Avenue, Newark. Our phone number is 973-733-7538. I'd like to give a brief background of how the Shani Baraka Women's Resource Center came to be. The center is named after our own Mayor Baraka's sister, the late Shani Isis Makita Jones Baraka. Shani was murdered back in 2003 of August, along with her friend Ray Sean, by their brother, by Shani and the mayor's family brother-in-law. He was actually looking for their sister, and Shani and Ray Sean just happened to be there. So they both women were killed. Shani was 31 years old, and she was amazing. She was a school teacher. She was being groomed to actually become the head coach at Malcolm X Shabazz High School. We all were a part of the coaching staff under the tutelage of Coach Vanessa Watson, and she actually helped spearhead our first Tournament of Champions title for Malcolm X Shabazz High School girls basketball team. So, in her memory, her family, her brother, the mayor, committed themselves to um, opening this center. I believe the mayor used to, as a councilman, used to ride by. The building was actually the old Peterman's Bakery, and I believe his vision was to create a facility, an environment to service women in need. You know, the Shani Baraka Center has a variety of services, free services for women in crisis. Um, our mission, which is the mayor's mission for all of us, our outstanding mayor, to empower women and their families to achieve safe, healthy, self-sufficient lives by providing support, education, counseling, information in a place that they feel safe and able to open up about any situation that they may be enduring. I like to share a couple of the services. I'll just go around. We have domestic violence counseling. We have a newly assigned violent advocate, Ms. Williams. We have sexual abuse advocacy. We have the trauma support, of course. We have a substance abuse counselor. We have actually with North Beth Israel, we have a partnership with them to actually come in, and we service men as well because our mayor don't want us to turn away anybody, although it's a women's center. So Beth Israel provide a mobile unit that they test men out in our parking lot, and the women to come in, and we supply toiletries for them and condoms and everything, and information that keep them safe. We also have the LGBTQ plus counseling service that's on site. During this COVID season, we were in a scattered schedule, but service is available for everyone. We also have a housing homeless agent who's fantastic. Um, Most of our staff are 9 to 5, but we don't have 9 to 5 hours. We're always on the clock because there's always someone in need. We have computer lab services. Some women may not want to um, come see one of the counselors. They may want to just check their email or try to build their resume. So we have a computer area where the women can come in and work on a computer. And we have a section for children, because a lot of the mothers, they come in and they want to utilize our service, and they may have small children. So we have a little space over there, and our own people assembly manager, Miss Mason here, donated several books and the bookcase. So we have that for the children, try to encourage that. And sometimes we have children and women on a run that come in. So we provide, outfits for them sometimes, and we feed them. Kids like, you know, cereal and food and everything like the rest of us. So we try to have that on hand for the families that come in. And right now we're uh, closing the gap with the public safety side, because the east wing of the building is made up of some men and women detectives that actually help us out with, well, we help each other out with the domestic violence women that come in. So we're working, on a team effort with that.
Ms.
And
Kettles?
yes,
Thank you.
ma'am.
That's a perfect segue in for us to hear from Captain Suarez.
Okay.
As we heard, Shani Baraka Women's Resource Center has everything imaginable for a woman. And they're not turning men away, but it is a woman's center. So any resource that you as a female could use should be provided, or you can get the information at the Shani Baraka Women's Resource Center. Although it is located in the South Ward, it is not only for South Ward residents. So please be sure to spread the information. All of these great resources that we have are open to all of Newark residents, and it is free of charge.
Absolutely.
So Captain Suarez, without further ado, can you let us know a little bit about what's going on that east wing of the Shani Baraka Women's Resource Center?
Hi, good afternoon again, everyone. The Special Victims Division, we handle everything from domestic violence cases, sexual assault cases, missing persons, whether adult or juvenile, in addition to other crimes such as bias crimes, bias incidents, things of that nature. Basically, everything is very victim-centered, as entails with the name, right? Goes in conjunction with our name. All our investigations are liaised through the prosecutor's office. So we work hand in hand with the prosecutor's office as far as the charging aspect, investigations, victim interviews, victim advocacy, as well as working in conjunction with the Shani Baraka Center and other resources that are available to our victims. As far as the types of investigations, domestic violence seems to take up the bulk of our work. Unfortunately, we see a lot of domestic violence cases on a daily basis. I'm proud to say that the majority of them, as we like to call it, closed out. We do make arrests. We issue numerous warrants. The victims do seek assistance. Sometimes they may be a little hesitant and may not want to speak to law enforcement at that time, or may be embarrassed or out of fear. So eventually we do point them in the way, and that's where the Shani Baraka Center comes in and helps out as far as getting them any counseling and services they may need. Again, some victims may be a little hesitant, they may be a little intimidated. Obviously, we're going to try to bridge that gap, as this always is the main focus, is to be victim-centered and show them that we really do care. We're there to help them, guide them, and basically make sure that they get exactly the help and resources they need from us and from whatever's available citywide, countywide, and even statewide at this juncture. The other issue we sometimes have too is we handle a lot of missing persons cases involving the elderly, which suffer from some type of cognizant disability. or disease. We're going to try to do something with that on a higher level, because we seem to have some that go missing quite often, for lack of a better term. I know we've been in contact with some of those families. I think we have to be more in conjunction with Shani Baraka, see if we can do something on the Women's Center side to help those families. I'll be reaching out in terms of that, because we do have some elderly people that go missing, some more frequent than others. See if there's any programs available, any counseling for the families, any help or instructions we can give them in conjunction with the center and other resources. We still have, we also investigate a lot of juvenile runaways, whether from residential homes or the YCS services. They take up a bulk of our investigations. I'm also happy to say the majority of those are also solved and provided with services. And I know the Shani Baraka Center tries to help out with counseling and stuff for those families that have that are parents of runaways, try to find out why they're running away, give them services, and pretty much guide them in the right direction. As far as the sex crimes, obviously they're the most egregious. Those are our victims that come in, and we have to be very, very intricate with the investigations, make sure everything's done correct, service them well, and make sure and ensure their well-being. So basically, we try to help out everyone in a fair way, let them know that the police are there to help and that we're available to them, and that we actually do care and we do understand that it just doesn't start and end with the police, and that they can go and seek help in addition to obviously the law enforcement and the other end of the aspect as far as social services is very, very important. And it actually helps us do our job better too. And at this juncture, that's pretty much what we handle. And if there's any other questions later on in the segment, I'll gladly try to answer what I can.
Thank you so much, Captain. And I just want to take this opportunity to just say thank you to each of you for the service that you provide for the city. And to even my office, Newark People's Assembly, we are really doing work in the city, working for the community at large. So community, please take advantage, and that's advantage in a good way. We offer these services. We have people that are being paid to provide the services. Some things, and not necessarily the things that we're talking about, but some things are underutilized, but we want you to know that we offer them, we have them. So please continue to spread the word, share the information, make sure that you even share this live, on your personal page, if you don't mind. So we're going to just take a step back before we get into the community conversation. Prior to introducing some of the leadership within the division, I wanted to hear from Thais, who will talk about some of the statistical things going on within the police department.
Good evening. Thank you, Andrea. Well, thank you, Central Ward, for having us here. With the help of the public safety, we made these graphs. So the first graph shows the citywide crime complaints, and this data is from 2018 to 2020. The blue bars represent all of the pre-pandemic data, while the green bars represent the pandemic data. We have three trend lines. The orange one represents the pre-pandemic data, while the yellow one represents the 3-year data overall, and the gray one is just for the pandemic. When we made these graphs, we didn't have the complete data for the first quarter of 2021, so this is why it's not included, but will be included in the future. Next to this graph, we have the citywide crime complaints, but disaggregated by precinct. So for this meeting, we're focusing in the first bar, the first precinct bar, and we had 228 citywide crime complaints in the last quarter of 2020. Next slide, please. Then, just like the previous slide, we have the citywide murder complaints shown from 2018 to 2020. And once again, the blue bars represent all of the pre-pandemic data, while the green bars represent the pandemic data, well, part of it. And next to it, we have the citywide murder complaints, but just for the precincts in the last quarter of 2020. So once again, for this meeting, we're focusing in the first bar. Next slide, please. And then we have the domestic violence incidents from 2018 to 2020. Sadly, we don't have the disaggregation by precinct, but we have all of the citywide complaints here. Thank you very much.
Thank you so much for that amazing report. And so at this time, we are going to begin our community conversation. And as we started at the beginning of the meeting, this is supposed to be an interactive conversation. So I will ask the question. Feel free to give your response or suggestion in our Facebook comments, or if you are tuned in through the webinar, in our Q&A. And so the first question that we have is, what other priorities or activities would you like to see the Office of Violence Prevention, Trauma Recovery focus on? I will give you a moment and feel free to share.
And while we are allowing individuals to place their comments in either the Q&A module or on Facebook, I'll read some of the questions or comments to be answered later, just so we won't have nothing going on at the time. So on Facebook, there was a comment, to prevent violence, is there a possibility of walking patrols? This will allow officers to interact with the residents in a positive way. It will also allow the citizens' concerns to be heard about things such as quality of life and community related. So that is something that I guess everybody can sort of answer, probably directly at the police precinct commander, but I'm sure that there are some other people on the line that can speak to that. Also, there are a few individuals that are very interested in volunteering. So that's excellent. We will provide that information. I'll try to have it pinned to the Facebook feed. And another comment is social services for the homeless individuals are needed. So if Director Yuri can speak to that at a later time, is homeless services something that your office would handle? And Ms. Fana, I'm not sure if you want to allow more time or if we want to go to the comments, if there are any.
At the moment, we do not have any comments, so we can either continue to share those responses that our Newark residents are sharing via the comments.
Yep, so I do actually see some came while I was talking, so I'll just read them. So domestic violence or homelessness, community service, mental health. Oh, that's one of the volunteers is interested in serving in those capacities. Also, human and sex trafficking. So Ms. Lewis mentions just human and sex trafficking. And if you did not tune in on Saturday, we did have a human trafficking seminar hosted by our clergy affairs office. So if you're interested in learning more about human trafficking, it was a dynamite presentation. You can view that on the city's Facebook page. It was recorded, so it's there. We had that. It was May 22nd, and it started at 10 a.m. just for reference. Also, there is a question, what is the city doing about the Springfield Avenue open air drug use area right by the basketball court? So they're referring to near Felix Fold.
No, it would be Oscar Miles.
Oh, Oscar Miles, excuse me. If someone can speak to that, Councilwoman, perhaps? Again, that seems like it's a police precinct commander question. Maybe
I was actually going to make an announcement that Captain Brown is on. I can find out, he's not underneath his name, but he did let me know that he's on. So maybe I'll get his name so we can bring him on to talk about that. Give me 2 seconds.
Yes, please. We'd love to upgrade him to panelist. So let's move to the next question, please.
The next question that we have is, what can make our programs better? And so with the information that Director Yuri has shared with us, what are some ideas that can make those programs, or if you have any ideas on how we can make these programs better? I'll give you a few moments. I do want to share one comment that was posted in our Facebook, and that is more presence in the community. So I'll give a couple of more minutes. Again, I'll reiterate the question: what can make our programs better?
So as we are giving our residents in our community a chance to, get their comments and questions in, I did want to address the piece around homelessness. We do have the homeless um, program at the health department. So we do have, and that's Sakina Hoyt is in charge of. So we do have a homeless services program at 110 William Street. In room 111, we have a social services to, be able to address some of the homeless needs. I know people are frustrated. Housing is an issue nationally. Homelessness is a major issue. So we are in the city working on trying to address the needs of people who are having issues around housing. We have a slew of people who are working homeless people, people who are in sheltering, people who are victims of violence and crime. And I had met a woman who became homeless because she was shot and she was victimized and she left her house. And as a result of that, she became homeless. And so we have to start to look at the amount of victimization that's happening, people who are shot, stabbed, robbed, carjacked, or afraid to go back to their homes because it's no longer safe, are becoming homeless, sleeping from place to place. As a result of their victimization. So we have to find ways to be able to help relocate families and help them to secure safe housing, working on that, which is a major issue.
Thank you so much, Director. I want to share some of the comments that are coming in. One of our residents said more transparency. And so if you want to elaborate on the ways that the office is going to be more transparent with the community.
Well, one of the things that I would certainly suggest, and this is a thing that I want to do, is the same way that the mayor comes on a weekly basis and give the information and numbers on the COVID, right? We can be doing the same thing under the violence prevention. If violence is a public health issue and we're addressing it the same way we're addressing COVID and the pandemic, then we need to be giving the information to the people in terms of what's happening in the community. A lot of times our media is not, getting the information out. The news is not covering our stuff. And so we have to tell our own stories and what's happening. So transparency is important. Whatever the data, is saying, we need to share the data, whether it's good, bad, or indifferent. And we need to tell the community what's happening, the good things as well as, some of the negative things. And so while our law enforcement is doing a great job, if you're not internal or interconnected, you won't necessarily know that. So we do need to share out how many guns they take off the street, how many robberies they intervened in, how many carjackings cars they recovered, how many people, that they helped, how many shooting victims, how many, were saved because the police officer intervened and helped them get to the hospital on time, or put a tourniquet to help stop the bleeding, or the violence prevention social workers helped to intervene at the scene to help law enforcement to be able to de-escalate a situation. So we have to be transparent. We got to tell our stories, and we have to report out more of what's going on in our community.
Thank you so much. We have another suggestion from that question in our Q&A, and I would like to read that. It would be great if you assign individuals who have been victims of crimes an assistant to help with navigating the NPD and the Victims Assistance Office. She shared when her apartment was broken into, it was really difficult trying to get access to officers who will help her understand the status of her case, as well as understand the investigation status updates. Similarly, when she lost a ring, it was stolen. It was really difficult for her trying to file a police report remotely due to the pandemic. And she encountered many officers who continue to transfer her throughout the department and refer her to different precincts. Interacting with NPD can be rather traumatizing and confusing. It will be helpful if a case manager was assigned to help navigate NPD.
I certainly welcome that suggestion, and I'm certainly looking to make anything that we can do to help residents be able to navigate these systems better. We know that we need support. We know that sometimes getting through to people is tough, and so they need advocacy. And so I'm in the process of hiring social workers, victim advocates, and case managers to be able to help people like her to manage these systems and to be able to get results and answers. So I'm in the process of working on that. I have hired about 15 new people. Just recently, I have done a hiring, but ultimately we want people who have experienced these things too, right? Peer navigators or people who've been through it that we can also hire. So I welcome the suggestion, and I certainly will follow up on it.
Now, Director Uri, just to elaborate on your hiring practices, and I'm sure you're doing this, but one of the attendees mentioned hiring staff with integrity, professionalism, and true concern, so compassion. So hopefully, you know, those are part of the requirements or the criteria for being hired.
So I again appreciate that comment, because what I find is in doing this work, this is a heart work, right? This is a passion work, and people may not be cut out for it, and they learn pretty quickly that this is not the work for them, because you have to show up with empathy to be able to help people. You have to have integrity. You have to have compassion, because people are fragile. People are showing up in their most fragile state, and they're traumatized. And we can't be so desensitized, and we can't handle people business as usual. Not under this office, we can't, but not under any city office, because we work for the residents. We are public servants of the people. And in being a public servant of the people, you have to be able to manage your own feelings, emotions, and all of those things, to be able to put them to the side to help the people who we are here for. And so I certainly appreciate that, because I know that customer service sometimes is not the greatest in social service entities and city entities. And we have to do better in terms of how we treat people, and that this is not a job. For me and the people I hire, I certainly let them know that this is not a job, right? This is hard work, passion work, and we're responsible for the lives of people. So we're in the business of helping to manage people's lives, because after something happens, we can't re-victimize them and re-traumatize them and send them back to a system or to a place, you know, that cause harm. So our job is to not cause more harm.
Okay, and the next comment, I apologize, I thought Jen was going to jump in there. So there is a comment about bringing law enforcement officers back into Newark Public Schools. Maybe, you know, the DARE programs, or, you know, it's not much detail in this question. It just says, you know, bring back the program where law enforcement officers visit the local Newark schools. And I'd like to hear from Captain Brown. Honestly, we do have a couple more questions that are probably directly concerning him. So Captain Brown, are you there?
Can you guys hear me?
Indeed, we can, and I'm going to change your name.
Yeah, I'm sorry. Thanks to Captain Soares for giving me the heads up about this. So I jumped on as quick as I could.
Yes, so, okay, so you probably didn't hear. There was a question initially about, well, there was a comment asking, to prevent violence, is there a possibility of bringing back walking patrols? So
Well,
everybody is not up on what big things the Newark Police Department are doing. So can you share what those initiatives are?
Well, currently the department has it's a community focus team. It's a walking team. So when we have certain areas, they'll bring 15 or 20 cops and they'll walk in certain geographical areas to, if there's something that happens, they're trying to stop something or prevent something to that effect. But commonly in the precincts, no, our officers, when they're working in the precincts, they do what they call walk and rides. So they'll park in an area and they're supposed to walk. As the councilwoman saw today, I had somebody down at Oscar Miles, and he was walking around today. So it's there in a format, but it's not a true walking post like we used to have years ago.
So Captain Brown, the comment also stated that with the walking patrol, it would make for better community engagement, allowing for the citizens' concerns to be heard about those quality of life and community related issues. So I know you mentioned that briefly you said that there's a team, but can you just talk about how often that team is deployed, if it is their 9 to 5 to be out in the community?
No, well, they're deployed at night, 7 or 3 in the morning, and they move around depending on crime trends. So, if something, if we have a bad incident somewhere, they might walk in that geographical area to help calm the area and interact with the people, make them feel safer to that effect. Yeah, I don't know much about the CPT team. I know they have a captain and they have about 15 officers, 20 officers, depending on the relief factor. But and that's what they try to do. They're a lot in the south and in the central ward.
Okay,
so I get them quite often.
More information specifically. I didn't realize there was another captain that was responsible for that team. So I'll get back to the resident with some more information. Thanks for the insight.
There was another question about Springfield Avenue, about the drug activity?
Yes, there was. It was specifically just mentioning what's going on about the drug activity in the Springfield Avenue area, the open drug sales by Oscar Miles.
Well, currently, yeah, that's an ongoing issue. Oscar Miles has been an ongoing issue for many years. But I think what they're specifically asking about is that little park next to the basketball court, because that's where all my complaints come in. And currently, the councilwoman's actually trying to move the bus stop, because a lot of issues that we run into is that the bus stop is there, and if you go to approach people, they say, "I'm waiting for the bus." So now that takes, moving them along, you can't do that. So, but the councilwoman came up with a great idea to actually move the bus stop, and that should, when that's done, it'll give us more veracity to go after people who are milling in the area and selling and doing drugs.
Thank you so much for that information. And so at this time, we're going to move on to the next and last question of our community conversation. And that is, based on your awareness of available public safety, violence prevention, and victim services, what do you see as being needed the most?
It's a profound question. I think it's the resource that's coming on board now. It's, as officers, we see this all the time. We see, women that are traumatized and we're locking their significant other up, and it's a bad situation then. But if we can refer them and you can get them counseling, that would be a home run, because the recidivism rate for our domestic violence is very high. So if we can thwart that and say, okay, this person, now we get this woman who might be in a relationship because of, financial needs. Now, if we get her resources, maybe she can get out of a bad situation, and we won't have that, and she won't be, violated or whatever's happening to her happen again. And, I think that's the big part of this whole conversation as far as domestic violence. Got to stop it.
So we're also going to hear some comments or share comments regarding that question to the community. Thank you, Captain Brown, for giving us your insight. I'm also going to read some more comments while people are thinking of their comments. I'll read some other comments that are coming in on Facebook. So for Director Yuri, actually, if you can incorporate alternatives to incarceration within your division, that would be helpful. And next comment, when will the community meetings begin taking place again, including the monthly women's meeting that were being held at City Hall? So, you know, as we know, the city is opening up slowly but surely. We are hoping to reach herd immunity before we totally, you know, just everything is back to normal, so to speak. But we are encouraging vaccinations, wearing of masks, and sooner than later, though, we will start having those in-person meetings again. So we will keep you informed and abreast. Community service is so important. Go ahead.
I wanted to read a comment from one of the residents that she shared. Pre-COVID, we've had community officers that would interact with the residents on different events, which bridged the gap between police and civilians. Maybe as things open up, we can revisit that. It worked for New Hope Village and still is. And so just like Ms. Mason was mentioning, the community wants to see us in the community interacting with them. And so if anything, you can also share Director Yuri in ways where the community can be involved with the office.
So we certainly welcome the community to be involved because the community are the experts, right? They know what's happening in their communities, they know what's going on, and they know what they need. So I certainly always welcome suggestions. We're going to be doing community engagement, community walks, and we did one on Friday. We actually did one on Friday in one of the areas, one of the hotspot areas. And we went and engaged the community on 15th Avenue and 18th Street. And people gave us and talked to us about what they needed. So the social workers, victim advocates, and case managers followed up with the information. So whether they said they needed housing, a job, an ID, social security cards, they needed to print out documents. The biggest thing was jobs. So, you know, we follow up with the information and the contacts that we got to be able to help, be able to advocate and help the people to get what they need. We ultimately believe that the more resources that people have, the less crime and violence that we're apt to have. The more time that we can spend with some of our young people or our people who are committing offenses over and over, we get to the bottom, the root of why they're committing these offenses so that we can help them to be able to get back into the community and reintegrate to be able to contribute positively. So really working on those areas, and the community is welcome to help us because they are the best knowers. I take all suggestions. I welcome all the suggestions. If we're in your neighborhoods and we're knocking on your door to get your feedback and to get some of your input, we certainly encourage you to engage with us when we're in your neighborhoods.
So just a few more things that I noticed on Facebook. What type of trainings will the new hires receive, Captain Yuri, excuse me, Director Yuri?
So they actually last week went through the trauma to trust training, which is we did the community side training, where they learned about different types of trauma, individual trauma, collective trauma, historical trauma. They are doing trainings with safety in the community. They're learning about different personality styles and types, how to engage clients and residents, the rules around domestic violence. They're learning about ultimately the training for them is around advocacy, how to really engage with the community. They're going to be doing trainings around like to stop the bleed, how to intervene in some of those things. And so just probably off the top of my head, those are the more immediate kinds of trainings that they're doing, but the safety in the community and trauma trainings are the the bigger ones that they're doing right now.
And just moving on down the list, because now we started off, it seemed like we had like hours. Now we only have about 15 more minutes before we wrap it up. So actually, maybe even 10. So another comment on Facebook, and we spoke to this briefly, but we also want to keep in mind before we totally open that there are many seniors that aren't getting a lot of the information because of this trend of doing everything online. So, just keeping that in mind as we're starting to publicize or continuing to publicize different things throughout the community, that we still need to do those door-to-door kind of campaigns, boots on the ground, putting the flyers in on the doorsteps or what have you. And then I see, can they bring back, we already asked that question, can they bring back the law enforcement officers within the school? And if Ms. Haynes is still on, is that something that would go through our police department, or is it through Newark Public Schools, or just simply a collaboration of the two?
It would definitely be a collaboration of the two. I was texting back and forth with someone that was in the group text on Facebook. And if she wanted it in her child's school specifically, I had advised her to speak to the principal. So for full transparency, I'm also the president of Newark Board of Education. So I was actually on another call with the superintendent and brought it to his attention as well. And of course, anything that's going to help our community, we're all for it. And in addition to that, the Newark Board of Education is also a part of the Brick City Peace Collective. So that's also a conversation that can be had in a full meeting prospects on how do we do that, where the pressure isn't coming just on the district or just on the police department, but the police department pieces that are there in the collective meeting can be able to help make sure that partnership is made as easy and as transparent as possible with the proper officers that deal with community relations specifically. We don't want just any police officers in front of our children.
Thank you, Donnie. And so I want to share one of the comments that was shared in our Q&A before we completely move on from the community conversation. And our resident states that she completely agrees that there should be an office that provides a copy machine and a scanner. It costs so much money to trying to get copies of everything. A police report costs $5. It may not seem like a lot of money, but it can add up. It will be helpful to have resources for printing, scanning, and such, because this can be very expensive. And again, she wanted to highlight that. Thank you for the platform and appreciating that her questions have been vocalized.
Yeah, I like that suggestion. I think everybody could use a place where, at no cost specifically, but even at minimal cost, to go and make copies, or just be able to, if you cannot afford it, to be able to offer those services complimentary. So Director Yuri, I hope you're keeping track. We are, in case you aren't.
Certainly am. Thank you so much. I'm writing and trying to keep track, but certainly I think that the community is on track in terms of the mission and the vision of the office. And the fact that we've never had an office like this before, we certainly want the community's input and how we make this work. And so we didn't even talk about that the first precinct is going to be the office of the Office of Violence Prevention over on 17th Avenue. And ultimately, we're going to be building out a museum, a conflict resolution. And so it's going to be the first of its kind. It's going to be on the first floor, but the other 2 floors is where the office is going to be housed. And so a place that was once a place where people was getting arrested is now going to be a place that people could come to get some help. And so we're showing you how restorative practices can happen, restorative justice, and how, change is possible. And so as we are sharing some of the space with community-based public safety and public safety, we're showing you that the community has a stake and have some ownership. And so going back to the question of what kind of training is the new hires getting, conflict resolution. is certainly one of the trainings that's needed. We're learning about crisis intervention, which is major, right? Crisis intervention and how you intervene, which helps us with our prevention, intervention, and our treatment. We're also going to have a trauma recovery aspect, right? Because we know recovery takes time, it's over time. And so the office is just unique and groundbreaking in terms of the things that we are looking to do. We're looking to become a national model for other cities to be able to model. And while violence is up in our city, violence is up nationally, everywhere. And so we are looking to find better ways and strategies to be able to prevent more violence from taking place in our city, specifically gun violence. And we know that domestic violence is a major issue, but these are national issues, but we really want to get a hold of it locally, and we know what we need. And so I welcome the community to be a part of helping us figure out and strategize around how we trickle the resources down to the community to make sure that we get to the core of why the violence is taking place in our communities.
Thank you, Director Yuri. There is one more comment that I'd like to share prior to the closing remarks. And that is, I mentioned earlier, of course, that people are interested in volunteering. There is someone specifically interested in volunteering at the Shani Baraka Women's Resource Center. So I've added that number to the Facebook chat, but I'll repeat it again, 973-733-7538. And is that the number that someone would dial if they are interested in volunteering and they go through a screening process and so forth?
Right. So that's our front desk number. So that is the receptionist. You will get someone that's going to answer the phone at the receptionist desk Monday through Friday between 9 and 5. So that is the number. That number is correct.
Okay, I'm going to backpedal for 2 seconds only because there is one more comment that came through. And this, I promise, is the last comment before the closing remarks. So this attendee states, I'm 52, homeless with a 17-year-old daughter. I've been looking for work. I can't work in a warehouse because if I fall on my right side, because I fell on the right side of my body. Is there any resources for someone like her?
Absolutely. The Shani Baraka Center, certainly go there. We have people who can help you. We have the homeless services specialist, Kiana Monroe, is at the Shani Baraka Center, who can help find resources to help address the homelessness and also for the employment. We did have a job developer there, but we still have access to job developers through the city. So please reach out to the Shani Baraka Center. It's a walk-in center, so you can just drop in to be able to get a case manager or social worker to be able to help you to address those immediate needs that you have.
Thank you. I don't see any other comments. Sarah says, thanks again. We do have a couple other remarks just saying thank you for the information. Hi, hey, ladies in power. So I am going to ask for some closing remarks. If anyone wants to speak prior to the actual closing. I know we heard from Councilwoman McIver very early on. We introduced Central Ward Aide to Mayor Baraka Al-Tariq Anquay. Captain Brown of the 1st Precinct is on, as well as Dawn Haynes with Brick City Peace Collective, Janice Kettles, manager of the Shani Baraka Women's Resource Center, Captain Suarez, who is the commander of the Special Victims Unit on the East Ward of the Shani Baraka Women's Resource Center. And I definitely want to thank the Bloomberg Associates team for being present. Do either of you have any closing remarks?
I would like for Councilwoman and Council Aide to close us out. I would yield to them for the closeout.
Absolutely. Please remember, everybody, that there is a QR code on the screen to complete. This one is ward specific, so it's specifically for this central ward meeting. If you can, snap a picture of it, take that survey. If for whatever reason you miss it, if you are connected with Newark People's Assembly, you will receive a survey at the end of the series. Thanks so much.
So I just want to first start off by saying thank you so much for putting this together and organizing this session. I think that number one is definitely helpful as we continue to push forward and start this office and kick it off and open up this new first precinct that's going to be a museum. As Director Yuri mentioned, there's a lot of work that is going into this. We are working with different committees, different advisory committees to get this done, and community input is at the heart of all of that. And so that's why this session was so important for us to get feedback from the community so that we know where we're going and continuing to push forward. We're making sure we're addressing the concerns of the community. So there's a lot happening. This will not be the last time, as there's still going to be an East Ward meeting this week, I believe. But we look to come back again just to continue the conversation, the community conversation. We've been having some small group meetings that the committee and underneath the leadership of Director Yuri have been spearheading. And so we look forward to continuing the conversation. This isn't the end all be. This is the start, the middle starting point of us pushing forward to do this. We're making history once again here in the city of Newark underneath the progression of our wonderful mayor, Mayor Rajay Baraka, to be the first to be able to do this in a municipality and definitely reform some of our police policies and procedures is definitely something that we're looking forward to. So I just want to thank everybody who made it possible, to Jennifer and Ms. Mason for hosting this and doing such an amazing job. And to my girl, Dawn, I'll be calling you with some more requests, Dawn, as we continue to push forward and be out here in these streets and in the community doing what we do best. So thank you all.
Okay, so I don't see that Mr. Anque is off of mute. So we will take this opportunity to end the meeting, excuse me. Have a great night. And if you want to tune in again, you are more than welcome to tune into the East Ward meeting that's going to happen 6:15, same place, Facebook Live on Thursday. Have a great night, everybody.
Thank you. Good night.